and welcome, my friends. Welcome to another episode of To The Point, the American Acupuncture Council always being your advocate. This is Sam Collins, the coding and billing expert for acupuncture in the United States and on a worldwide basis for the WHO or World Health Organization. I want to give you a little update. This past week, I did get a chance to speak to the Council of Colleges of Oriental and Acupuncture Medicine. And that was meaning speaking to all of the heads of the colleges and really a discussion on just the continuation of improvement of all the issues related to acupuncture, whether it's just better curriculum, but also better understanding from the business end. So I'm partnering with a lot of the schools now. So please take a look. We'll be coming to a lot of the schools. We'll be doing more and more seminars there to make sure that you have a good understanding of coding, billing, documentation. Today's episode is going to be on documenting evaluation and management. Evaluation and management codes are, of course, an important aspect of care because you cannot treat someone without evaluating them. My problem that we've run into, though, is because at the American Acupuncture Council, we, of course, provide you with audit protection. So if you're being audited by an insurance, don't panic. If you're with the American Acupuncture Council, we're here to protect you. They will pay up to $30,000 of legal help and other aid to make sure that you don't have to pay back or make sure we're doing things properly. Well, one of the issues that we've run into recently is evaluation and management codes. You, or maybe some of you, your friends that you may know, may likely be getting some letters. Blue Cross and Blue Shield, United Healthcare, and a few others are beginning to send letters out, usually this time of year, to let acupuncturists know the percentage of patients that they're using E&M codes, the levels, and whether or not you're fitting within what they consider the norm. So let's go to the slides and get to some details on evaluation and management coding. As always, take a look. There's my email and information to get a hold of us. Obviously, we know evaluation and management codes are the standards, 99201 to 205, new patient or established patient. I think that's something that doesn't really require we do a whole lot there, other than to say these are the codes that we use to document, if you will, on a bill, the services we have provided. Reason I make this an issue is take a look at this audit that we've dealt with recently. And you'll see here I've highlighted the area, and it says, a doctor billed a 99213, and it says evaluation and management services billed were unbundled from the primary acupuncture code. Now, the doctor did bill with a 25 modifier, but they're saying it's unbundled because it says all acupuncture CPT codes include an evaluation and management component built in. To be eligible for payment for a separate E&M service, the documentation would need to demonstrate that the service went beyond the brief assessment included in the acupuncture code. The records provided did not document sufficient key elements to support that a significantly separately identifiable E&M service was performed. Now, certainly, I think you're all aware that you cannot bill an evaluation management daily, but even when you are billing it, does it stand out? Does it become a separate, distinct service? Remember, acupuncture does include a little, hey, how are you doing today, and a quick evaluation. Here's another example, and you'll see it says at the top the purpose of the audit, but I want to focus in on the section here that's circled in red, unsupported. It says each of the 36 claims, it says the separate E&M services were not supported. So how do we support this? How do we make sure we've done it? Well, E&M codes have seven distinct descriptors that recognize the components of it. Now, 6 of which are used to evaluate the service. So I do want to be a bit careful here. First thing, of course, is one of the things we have to do is a history of a patient. So make sure when you're documenting an evaluation, there's a clear history documented. There's a clear examination, and not a simple examination, but one above and beyond what you would do day to day. And there's some medical decision making. And this is really the big difference of an exam. When you do an exam, you're resetting your treatment plan. So these are the major components. These are the things that are an absolute requirement, but there can be other things included. Of course, counseling. I often think of counseling as your report of findings, discussing with the patient. That's certainly part of it. Telling them what's wrong, what your anticipated treatment plan is, length of time of care, and so on. It could also be coordinating care. Not always, but certainly there could be some concurrent care or referral with another doctor. And certainly all this kind of comes back to the nature of the presenting problem. Clearly, the more severe a problem the patient presents with, the greater level of history exam that's provided. So nature of the presenting problem kind of sets up, is this going to be simple or complex? The thing that really isn't included, though it's one of the 7, is time. Time is meant as average. And as I'm sure you're aware, you'll look at the codes and it says physicians typically spend. Typically spending in time means that's an average. It's not an absolute. And I bet most of you who are listening to this probably have had an opportunity where you've seen a medical doctor for a very short period of time, yet they build a very high level code. And the reason why depends on what you're seeing them for. The greater the nature of the presenting problem. Certainly, if you're going to a cardiologist, that's not a simple exam. It's going to be higher. So the time is not really a major component. So what I want to focus on is documenting the E&M. And what I want to make sure is that there is a clear evaluation above and beyond the pre and post service work associated with acupuncture. Make sure if I were to review your notes, or anyone, would it be clear that there's an exam? I'm going to say to most of you, you should have an examination form. This form should be clear. It should be noted as an exam form. So every time that appears, it's clear that there's an examination being performed above and beyond what's done day to day, because the day to day just goes as part of the regular SOAP note. So the first thing you have to think of is, well, what are we documenting? Well, the nature of the presenting problem and the history are really the major factors. And so tell me where the pain is. Tell me the quality of the pain. Tell me something about the severity, the duration, how long you've had it, the timing, the context of the pain. In other words, kind of the OPQRST, if you're familiar with that. But in other words, give me what's going on with your symptoms. I think that's pretty straightforward. But make sure if it's a re-exam, you have to go back through that, like, how's it been since last time? Again, make it clear it's above and beyond just the day-to-day. In addition, there could be other modifying factors. These modifying factors could be things such as patient has other underlying conditions, or maybe there's other associated signs and symptoms. Maybe there's some chronic or inactive conditions that could be part of it. Maybe it could be a review of symptoms. Realize that it includes all of that, but always remember it could include family and social history. Sometimes family and social history have no importance for what they're presenting for, but sometimes it does. So therefore, for an exam, just getting the history and present illness is going to have some of these elements, making sure that, again, it's above and beyond what you see day to day. Then, of course, you're going to do an exam. Now, the exam, of course, is what you determine it to be, but it's essentially an evaluation of the area of complaint and the associated regions with it. So in other words, an exam of the ear, if they came in for neck pain, I'm assuming you would look at their neck and any contiguous area more than likely. But this exam is based upon these evaluation and management guidelines. Now, this is a big guideline. I'm just going to give you a highlight, but I want you to see here that each code, 99201, 212, 202, 213, notice I've highlighted what it says to qualify for this exam. Let's just pick the one that's a 99202 and 203, and it says at least 6 bullets from any organ system. Now, you may wonder, well, what are these bullets? Well, what bullets are exam elements. Things you do, like palpation would be a bullet. Range of motion would be a bullet. Examination of the tongue would be a bullet. In other words, things you do for an exam, and it breaks the body down into organ systems. Now, these organ systems, whether you agree or not, these are the 15 of them, constitutional and otherwise. And to just make it simple, make sure that if you're going to bill a 99203, the guideline says you have to have at least 12. So some of the ones that you may be doing, notice here's one for constitutional. Just doing vital signs would be a bullet. But just general appearance. Have you ever heard the term, someone might say the person is well developed, well nourished? That would certainly be an exam element. In other words, you're reviewing this patient in general. There's other parts like ear, nose, mouth, and throat. Now just take a quick moment. Notice number 6 on ear, nose, mouth, and throat, and it says examination of the oral pharynx, oral mucosa. But notice it does discuss the tongue. So certainly tongue diagnosis could be part of it. But anyway, I don't want to spend too much time here, just saying, please take some time to look through the 97 evaluation management guidelines to make sure, am I doing the proper things to qualify? If you're billing a 99203, I need to see that there are 12 elements documented on this exam. If you're doing less than 12, it will be a 202. If you're doing less than 6, it would be a 201. So making sure that you always have the right one. And again, I have no problem with what level that's necessary, but make sure it's above and beyond and distinct. But we'll run through here. You're going to see things like cardiovascular. Now, you may not think of cardiovascular much for acupuncturists, but take a look at number 7, examination of the pedal pulses. I think that's not uncommon for an acupuncturist, particularly if a person comes with a musculoskeletal problem. You're probably going to be looking at extremities for swelling, varicosities, and so forth. In addition, there could be a gastrointestinal exam, genital urinary, but again, it just breaks down the body area. So become familiar that when you do an exam, the exam must document the number of elements to qualify for the level of exam that you're doing. I would say it's pretty typical for most acupuncturists to fit somewhere between 99201 to 99203, with a slight favoring towards the 203, simply because you often see patients with very chronic conditions, and you have to rule out other underlying more severe problems. So don't be afraid to be a little bit more risk averse by making sure that it is just a simple problem, not a more complex. It includes lymphatic, musculoskeletal, head and neck areas, skin, neurologic testing. And I'll give another one here just as a quick note. Notice under psychiatric, the bottom three indicate orientation to time, place, and person. Realize if you tell me a patient is oriented ×3, that's a bullet. That means that they're present. They know where they are. They're aware of their surroundings, even their mood. So the key element is document it. If you didn't document it, it didn't exist. So if you don't tell me the patient is well developed, well nourished, it means it wasn't evaluated. So do make sure that you must document these things. The issue though is do an exam. Now becomes the medical decision making. The medical decision making is a conclusion of your history and your exam. In other words, you're coming up with your diagnosis. Based upon this is what I see the patient as having. It may include coordination of care with other providers if necessary. That certainly is not always necessary, but certainly potentially could be. In addition, it's going to include counseling. So don't forget, document the counseling. Tell me what you explain to the patient. What is your treatment plan? I want to see you 2 times a week for 3 weeks. I want to reduce the pain 50%. In other words, a plan. In other words, for an exam, there has to be, following the exam, what is your plan of care? And I think that's where the counseling comes in. Here's my bottom line. Do your notes reflect that if it was reviewed, a clear and distinct exam was provided? I believe that acupuncturists do exams, but often don't document enough of the information that they see in order to qualify. So take some time to look, are you using a form or a format to make sure that if you're ever audited, be preemptive. Audit yourself, take a look and go, when I built this exam, do these notes reflect a clear exam that's above and beyond what I do day to day? If I see a note for an exam that looks reflective of a note where there's a day-to-day visit, I'm not sure there was an exam provided. You certainly can code one, but it certainly would appear that it's going to be part of the acupuncture service. Bottom line is we want to help you. The American Acupuncture Council Network, we do seminars. Please take a look at our Instagram and Facebook. Go there. We have information. It's news. There's recent information up there on ASH and others that are happening in New Jersey and California. Also updates for the new year, for new codes. Where's your resource? We want to be that person for you. Make sure that you're not getting it from a place that you're not sure it's been vetted. Come to a continuing education seminar where you can get certified hours. I thank you so much. We're going to be off next week for the Thanksgiving holiday. I'll be back with you in 2 weeks. But again, thank you and the best wishes to all of you for your success.